I'm Tilman Kruger, and I work for MSD on oncology policy in Europe. I think the conference provides a very good opportunity to bring together very different types of stakeholders and partners in the system. I obviously represent industry, but we've seen a lot of participants also from the public sector, and most importantly, the patient community, as well as academia, scientists and researchers. For me, it's a great opportunity to learn about a lot of the ongoing projects, which have often been stimulated by EU science-funded programs or following landmark initiatives like Europe's Speeding Cancer Plan, Horizon Europe, etc. So it's on the one hand very good for me to learn about the progress of some of these projects, and I think the other big interest on my part is to really learn and understand where some of the challenges still remain and where some of the progress is that still needs to be made to make sure that, like the title of the conference says, that innovation really also reaches those that need it most. I think it's one of the key outcomes from my end of the conference is that on the one hand, international cooperation, starting in our case mostly in Europe in the first place, has prompted a lot of very good initiatives, activities. But at the same time, what we also realize is that just because something is planned and maybe put on in a paper, in a document in Europe, doesn't necessarily mean that it reaches each and everyone in Europe. I think the sometimes lack of translation of innovation into the markets, into the countries, into the communities has been sort of like a shared identified challenge that's still there and remains to be addressed. I think also that we've discussed and continue to discuss a couple of very good solutions around it. Depending on each speaker's affiliation, they tend to focus a bit more on improvements to the academic work, to the involvement of patients, for instance, into shared and joint decision-making, or that's a point that's very important to us, is to improve the governance mechanisms that are underlying the translation of innovation, how to equip our regulatory, our reimbursement, our healthcare systems so that they actually are in a position to accommodate and appreciate innovation in a way that is sustainable and also beneficial to patients. And I think Europe provides a very good test bed for a lot of these questions, both just because of the history of Europe and how we've started to and come to work on these topics, but also because of some of the more recent initiatives. Again, Europe's Speeding Cancer Plan or other projects stand out there. And I think for areas outside of Europe, there's a lot to learn on the one hand from past successes, but also failures and mistakes that we here in Europe have done and continue to do once in a while. And at the same time, I think provide a very good, almost like a blueprint of good things to take on, also in other areas, but then also probably a couple of things to avoid and to focus on. So for me, I think we can see there's a lot of challenges to healthcare more recently, which essentially are very understandable because we know that other policy areas have become more and more important and prominent to be addressed. While I do understand this, I would still say that to a certain extent, at least, is a shame, and we should all work and focus to really keep healthcare front and center of our policy, but also regulatory and other initiatives. I think the COVID crisis has shown this, the continued unmet needs in all different kinds of disease areas, including in oncology, and demonstrate this very clearly. And I think we should all focus. Conference like this and also the events surrounding it give me great hope that there is a shared understanding of this continued prioritization of healthcare and specifically of cancer terms of prevention, treatment, care, in all aspects. So I think I'm actually quite hopeful. I'm not sure if I would go so far to formulate a clear vision for this, but I would hope that the coming months and years will help to convince me that we have a clearer vision on this. But I think the prioritization of healthcare is a very strong message and signal that comes from this conference, and that I think is now upon us to make sure that there's continued innovation in the first place, but also that innovation reaches countries at local levels, but then also patients, obviously, across Europe and beyond Europe.